Back, everybody. It's time for Ask the Expert. 9:14 now. Our friends from Deschenes and Poitras Dental Centre are here this morning. We're taking your phone calls, too, if you have any dental questions. Our topic today might be one you'd like to weigh in on, but if you have any dental questions, we'd be more than happy to entertain them. 613-789-6559, extension 2803. You can email, Facebook, or tweet us questions. Whatever way you can get in touch with us. We don't mind. Good morning, doctor.
Good morning.
How are you?
Oh, not bad at all.
Good. You have a good weekend?
Yeah. I got a lot of work done around the house.
Did you? Around the house?
Yeah, it's so cold out.
I know, eh?
It wasn't pleasant.
Dr. Michael Poitras here. We're going to talk about, now this has been a controversial issue about x-rays.
Yep.
And the amount of people, amount of x-rays people have had in their lifetimes and so on and so forth. What, in a nutshell, give me the main complaint that people are having.
Well, the main thing lately is, if you use these x-rays, is the exposure and the new study over the last, last few weeks, that are saying that it's causing tumors and stuff like that. But we got documents soon after that from our college stating, well, it's plus or minus on that study because the study was done with people remembering how many x-rays did they have in their past and stuff like that. From like 20 years ago, how many bite wings x-rays, how many panoramic x-rays did you have 20 years ago, 30 years ago when you were a kid? How do you remember this? It's hard to remember. Now there's another thing on that.
You can check your dental records.
Yeah, but this was done by all recollection, and dental records are kept 10 years max.
That's it, eh?
That's it. So now, if you change dentists, well, if you stayed with the same dentist for 20, 30 years, he'll still have the records for 20, 30 years. But if you change, he'll keep them for 10 years and they're gone.
What are they saying the problem is? Overexposure to...
Well, they're saying that it's related to non-cancerous tumors in the brain. So, but the study goes along the lines of, well, how many x-rays did you get done when you were 20, when you were 15, when you were 10? I don't remember last week.
Right.
What did you wear last week? I don't know.
Luckily, I was fully clothed.
Exactly.
Right. So this study kind of is a little
so
off
it's
center
a little on the iffy. And the other thing is that way back then, 20, 30 years ago, the x-rays weren't as good as they are now. Now you got the modern day x-ray machines are like this. They're very precise. They don't scatter the x-ray everywhere. Right. It's very precise, and the exposure is a lot less, especially if your dentist is using digital x-rays, which is on a computer.
Are you using digital now?
I'm on digital. It's been ever since I have my office.
So is there any danger in digital x-rays at all?
Any x-ray exposure, there's some risk, of course, but we're talking about a quarter to a tenth. Depends who you're talking to and everything. I can't give you a precise number on of the x-ray exposure. So I always say that to my patients, I could take 4 to 10 of my x-rays to equal one of the old style x-rays of x-ray exposure. So that's a lot less.
Yeah.
And then the study that was done, this was not available at the time that they got those people have been exposed.
Plus, you're relying on information that isn't conclusive when it comes to the old x-rays anyway.
Yeah.
I mean, how many people in this country, for example, would have had x-rays from a dentist as a kid?
Yeah, and how do they know that it's from x-rays? It could be from cell phone use, could be from frequent flights. An airplane, you're exposed to a lot more than one dental x-ray in an hour flight, a lot more. Right. And depending on sea level, if you're higher up in the altitude, you're getting exposed to more x-rays from the environment than somebody who's at sea level, etc.
These digital x-rays, by the way, are a little freaky.
Yeah, you can see it pretty well, and you could, as big as your screen is, that's how good your x-ray is. And the other thing, how it reduces, holy molar.
Holy molar!
Now, how do you reduce the x-ray exposure on this is that you can't screw it up. If it's too dark, well, the computer will modify it to make it lighter. If it's too light, it'll modify it to make it darker. It'll clarify it, etc. In the old style, if your x-ray wasn't good, well, you'd have to expose again, take another x-ray, and then put it through chemicals and stuff like that to develop. It would take 5 minutes to develop. This is like instantaneous. It's on the computer.
So you can take this picture and bam, right? It's right there in front of you.
Exactly. It's pretty
so
quick.
Helpful in what you did.
Yeah, it's very helpful.
I mean, think about trying to do dentistry without any x-rays.
It's impossible. It's like trying to find something, a needle in a haystack, and only seeing half the thing.
Well, it's like trying to find a needle in a haystack without your eyes.
Yeah, and then there's importance to X-rays too. There's a lot of importance. This guy here, for example, he's around 20. You see the darkness all around here compared to this side?
In the gums?
It's more in the bone.
Oh, is that in the bone there?
He had a big cyst. And he would have lost half his jaw if we hadn't taken that X-ray. He ended up in surgery, and they had to lose this tooth and clean all this out. He would have lost half his jaw, and he would have had to have maybe a rib transplanted and stuff like that to save his jaw. And this guy here, we caught it with a digital X-ray, and it was done and sent off to the specialist right away.
Yeah. And the thing about X-rays, no matter what type they are, digital or otherwise, you only do them when it's necessary.
Exactly.
It's not like you're doing them for fun.
Well, one of the things, the concepts in dentistry is called ALERA, which is as low as reasonably achievable. So you're always trying to reduce as much. But then on the other side, you can't go blindly. You find a cavity like this is a cavity. You got to know, does it go all the way to the pulp? Is there an abscess related to that tooth or not?
Because you can't see it otherwise.
You can't see it otherwise. I don't have X-ray vision.
Am I right in saying it'd be impossible for you to determine that sort of thing without X-rays?
Well, at this point here, you'll see pus coming out of the gums, okay? But
that's too little, too late.
Too little, too late. But the thing is that they're not always this big and this clear. Of course, I chose the ones that are the clearest and the biggest so that everybody sees it. But there'll be a fraction this size, and then we got to catch it. And before it gets to that point where you're going to potentially lose the tooth, potentially send it off to a specialist.
Doctor, how much do you depend on X-rays for what you do? Like, give me a percentage-wise.
90, 95.
Yeah.
When we do the exam, it's to see what's on the teeth. Between the teeth, we can't see it. We can't see bone level. We can't see what's going on under at the root tips, which is abscesses and stuff like that, which is bad bacteria that could cause problems elsewhere in the body.
Now, some people might argue, though, like, what did they do before X-rays came along? Well, they just took your teeth out.
Yeah, exactly. Now we're saving a lot of teeth, and by saving a lot of teeth, you're saving other problems. You're digesting better. You're chewing better. You're preventing. They're talking about tumors and everything. If you're not chewing well, your body's working overtime to try to digest stuff, which causes other problems elsewhere. So, anyways.
All right. If you have questions about X-rays, feel free to ask them. If you have questions about any other thing related to dental work and so on, again, feel free. 613-789-6559, extension 2803, ottawa.morning@ctv.ca. Or Facebook is CTV Morning Live, CTV Ottawa Morning Live. Feel free to do that too. If you're looking for Deschenes and Poitras Dental Centre, that's exactly where you'll find them, on Main Street in Stittsville. Go visit their website, visitordentalfamily.ca. Had a look at that, make sure I said it right. Yeah. We'll be back with more of Ask the Expert. Bring your questions on about anything dental related. We'll try and answer them for you. We'll be right back.